excitement. Right here. Right here on Traxx FM.
Good morning and welcome to this week's edition of What Matters. It's Kong Yu with you for the show today, dated Wednesday, May the 5th, 2021. I hope you're having a good Wednesday so far. As always, welcome to What Matters, where we talk about an issue, an aspect of life concerning both you and I. And we delve into some key details with the expert of the day to talk about a particular angle, yeah? So we're well into, I think this is the last third of the holy month of Ramadan. Of course, it's a fasting month for many Malaysians, and also for Malaysians who actually do observe fast from time to time, whether it's due to a religious background or maybe just as health practices and so on, right? So today we're going to find out from my special guest today about how to fast healthily and also effectively. Now, in particular, if you also are undergoing certain medical treatments, or maybe you've got certain health ailments as well, right? So here to shed light on this particular aspect, right, is Dr. Haji Azriman Rosman, who is the MAA Medicare Charitable Foundation's CEO himself. He joins me today for the segment on What Matters. Thank you so much, Doctor, for taking time out for the show today, right? We appreciate you coming on board and also coming as live in the studios of Traxx FM. Speaking of live, we have also gone live on Facebook. So do join us there. We are at Traxx FM Official if you'd like to join us with your comment, questions, and so on, right, for Dr. Azriman today. Once again, a big thanks for coming into the studios today.
Assalamualaikum to all Traxx FM listeners. Good morning, Kong Yu. Thank you, Traxx FM, for having me on board today. I'd like to take this opportunity firstly to wish everyone Selamat Hari Raya in the coming last weeks of the Ramadan. And also, please don't forget your SOPs. Although, some states are under MCO.
That's right.
And there's still the opportunity to keep in touch with your loved ones and, stay safe and make sure that, everyone is well away from the risk of infection.
Right. Thanks for that wish. And it's really important, right? SOPs. Way and above beyond anything else. That's what actually we need to do, right? If you want to actually really be proactive in letting the course of the pandemic, tide over and blow over ASAP. Yes. So thanks for the reminder, right? In the meantime, we talk about fasting, right? So let's talk about that and the effect first on our body. Now, people do it for many reasons, but all, I guess, the fundamental to it is it's similar, isn't it?
Yes, right.
Yeah.
Right. I think I'll start with, fasting. As you mentioned earlier, it's not just the Muslims who fast. And in fact, if I can go back into history, even in the 3rd and 4th century BC, Hippocrates, as you know, is the father of modern medicine.
That's right.
And he himself wrote to say that if you are sick, do not eat. To eat when you are sick is to feed your illness. So in fact, and even the early, during the ancient Greeks, fasting was a way to make your body healthy. So what happens when you fast, as you were asking? Basically, of course, the blood does not use the current carbohydrate or whatever you're eating. It then goes into the reserves and breaks down glycogen and fat to produce energy. But more importantly, there are a number of changes that happen when you're fasting, and which can be beneficial to health. So overall, you have, it's like you're allowing your period of rest for your stomach. And this kind of detoxifies your body, and it allows your body and the whole of the digestive system to take a rest. A number of other changes also happens, and you get, in fact, better control of cholesterol, blood sugar, and these are some of the beneficial effects of fasting. The period of fasting also allows your body to rest and repair, because when you're fasting, there's less release of free radicals, and as you know, which can cause cancer and illness. And this allows your body to cleanse itself of all these toxic chemicals. So that's why there are benefits of fasting, and of course there are risks associated with it as well.
That's the thing. Speaking of which, what are the risks? Now we're talking about fasting in its generality, right? So what are the ensuing and possible risks associated with fasting?
In a normal person, depending on the periods of fasting, there are various types of fasting. You can fast with a just water, but in the Muslim sense, fasting would be a total abstinence of food and water for the period of a day. So fasting obviously will cause for you to drop in your level of blood glucose, and obviously for people with certain illnesses or predisposed to certain conditions, medical conditions, there is a risk of hypoglycemia, a drop in blood glucose, feeling of faint. The blood pressure might drop as well. And of course, long-term fasting, you can in fact lose some weight. But usually what happens is, as you know, people eat so much over the night,
right,
and then immediately binge themselves when they break fast.
Right.
A lot of people in fact gain weight during the fasting month.
Yeah, that's the irony of the situation. Yeah, I mean it's total calorie in versus calories out. Yes, yeah. At the end of the day, it's still the same.
And of course, if you have a medical condition, then obviously there's higher risk there. If you have uncontrolled diabetes, for instance, or hypertension, even chronic kidney disease, that will obviously, you'd have to be careful when you're fasting and to make sure that you don't exacerbate the risks of fasting.
Now, of course, you guys, right, at MAA Medicare Charitable Foundation, I mean, you're providing, care to underprivileged people, underprivileged groups, including those who do suffer from chronic kidney disease, right, with dialysis treatments and so on, right? So let's talk about that a little bit. And then also talking about fast for those who are suffering from the chronic kidney disease. Yep.
The kidney, we have a couple of kidneys, one on the left and one on the right. So the kidneys actually filter toxins. They maintain an electrolyte balance for our body. They also secrete some hormones. So essentially, the way the kidney works is it cleanses the body by excreting water and salts, which the body doesn't need. So obviously when you're fasting, there's a limited amount of intake of fluids. And that will then reduce the ability of the kidney to filter off the toxins. So beyond a certain filtration rate that kidney, if your kidney is not working, then that will obviously cause problems. Now in kidney disease, there are about 5 stages. 1 to 5. Basically 1 to 5, 1 to 4 will mean that you still have a fairly stable kidney function, residual kidney function. And stage 5 is when you are in, quite a serious stage of renal failure. The stages from 1 to 4, perhaps with a reasonable glomerular filtration rate, the rate where the kidneys filter, they can still fast, probably requiring closer monitoring and supervision. But if you have a stage 5 kidney disease, then most doctors will advise you not to fast, in fact, because obviously health takes priority.
That's right. So stage 1 to stage 4, it's okay.
Yes.
Right, to fast. Within which parameters? Are they able to share some more details on this?
The 2 kidneys that we have provide a total filtration rate of about, say, 90 to 120 milliliters per minute. When you have 1 kidney, you're functioning at about 50. That's half of the filtration rate. Normally, if you have a filtration rate of about 50, it's still okay to fast. In other words, so sometimes post when you have a renal transplant, or if you have serious kidney disease that affects the kidney function, and both kidneys, the total filtration rate is half, being about 50, then that will be the limit. If it's less than 50 or around 50, it's not advisable to fast.
Okay.
So when you're fasting, the kidney filtration rate drops by another 10, 11 milliliters.
Right.
And that will compromise further the ability to filter.
Okay. All right. So when we're balancing, fluid intake, the lower fluid intake, right, during Ramadan because of the fast, and also the balancing against the benefits of fasting, right?
Yes.
Right. So I guess it really depends on that, right? If you feel the rate of 50% and below and so on.
Yes.
And also, does it depend on the other pre-existing health conditions of the patient?
That's true. Yeah.
Or maybe they need to also maybe lose, a few pounds and so on.
Yes.
Right.
Certainly, if there are other comorbid conditions, if they suffer from diabetes, hypertension, or high blood pressure, and there are other medical conditions, heart failure, for instance, that would obviously compromise on the body's stable mechanisms to regulate fluids. So in those cases, fasting, there's an added risk in fasting, because you need a finer balance of electrolytes and fluids,
Right.
For your heart to function properly. So obviously in those conditions, generally the doctors would say that either you go under strict supervision and very close monitoring of your blood parameters. Otherwise, it's really, Islam doesn't health takes priority, and you're not forced to fast. And I think most doctors would also advise patients with comorbid conditions and other related medical conditions, not to fast, and to take care of their health as a priority.
Right. Always going back to that.
Yes, that's right. Correct.
Everything that is to do with the aspects and including the most basic tenets of fasting is actually for good health overall. Right. Yeah.
Having said that, actually about 13% of people with end-stage renal failure actually do fast. So you can still fast with proper supervision and monitoring of the blood parameters.
Interesting. Yeah. All under, of course, doctor's advice and the supervision.
Yes, correct.
Right. Of which, of course, we have an expert in our midst today, Dr. Haji Azriman Rosman, who is the CEO of the MAA Medicare Charitable Foundation, here on What Matters with us. We're going to take a very short breaker. Back in a bit with more for our topic today on What Matters.
Enjoy rides and dips in the river with the elephants in Kuala Ganda. Traxx FM 105.3 Kuantan, Pahang.
Welcome back to What Matters. It is Kong Yu on the segment, as always, with you. And also this hour joined by my special guest, Dr. Haji Azriman Rosman, who is the CEO of the MAA Medicare Charitable Foundation, here to share with us some details as to the suitability of the fast for those who have chronic medical ailments like chronic kidney disease and so on. And also we touched about those who have heart issues as well. Right? And it's very important, of course, to be vigilant of your own health condition and to follow your doctor's advice as to, what sort of fast can you observe and also to what extent and so on. Yeah. So thank you so much for coming in to shed light on this topic. And just a quick little rounds of shout outs from our viewers on Facebook Live. Maybe a couple of questions here as well.
Right, sure.
Dr. Sam says good morning. He's a regular supporter.
Okay.
He's a doctor himself. Patricia Lim, thanks for your little hi. Muhammad Shazli says good morning, Dr. Azriman.
Good morning.
Boniface, good morning, DJ Kong, doctor and Traxxers. Jennifer Lau, good morning to you, Jennifer. Shamila says, good morning, Kong Yu. I always listen to you on radio. Today is my first time watching you on Facebook Live. Well, thanks for joining, Shamila, and hope to see you more on our feed as well. Yeah. Meanwhile, Lubna Cordoba gives a round of applause to you, doctor, for coming in. If you have a question, if you have some medical ailment, if you do suffer from some kidney issues, and you have been observing a fast, or maybe you haven't, depending on which situation, or if you just have a question for maybe a family member or friend, feel free to post in the comment section before we actually, have to conclude the segment today. Yeah? So we are at Traxx FM Official, live now on Facebook as well. Yeah. So we were talking about doctors and the advice and so on, and the suitability of fasting for those who do have kidney disease, for example, right? So just as a brief recap to those who are joining us for the second segment, so which parameters? I understand there's something that's called the estimated glomerular filtration rate.
Yes, yeah.
Right, so tell us about that. Yeah. What is that all about?
That's actually it measures the ability of the kidneys, the two kidneys, to secrete various chemicals. One such chemical that we measure is the creatinine, which is a byproduct of protein metabolism. So when you eat protein, it gets broken down and you produce creatinine, and that is excreted via the kidneys. To do that, the kidney has to filter, and the measure of the ability of the kidney to do its work is to look at the rate at which it filters. So as I mentioned, the filtration rate is about 90 to 120 for both kidneys, about 60 each, right? So if you have one kidney, or sometimes when you donate your kidney to a loved one, you're left with one kidney, you're functioning at half the capacity, which is about 50 or 60 milliliters per minute.
Right.
So that will still be okay to fast and lead a normal life. So that rate would be a measure of the kidney function. And having said that, so when you're fasting, the creatinine levels can increase because you're taking in less fluid. There's less filtration process going on, and the creatinine levels will build up. And if it builds up to about 30%, then you're really not advisable to proceed with the fasting. So if you do fast, then you keep a regular check on such parameters as the creatinine level in your blood, because that will measure the ability of your kidneys to filter.
Very important advice there, especially for those who are suffering from chronic kidney disease,
yes.
right? Normally stage 1 to stage 4.
Yes.
Right. And of particular note, if you or somebody you know is in stage 5 kidney functioning, then you have to be really careful.
Right.
In terms
advisable
of,
not to fast.
That's right.
Stage 5. Yes.
Yes. Advisable not to fast, even though, doctor, you made a point just now. Was it some 13%?
Still do. Yes.
Yeah, still do.
They're probably more in the category of stage 1, stage 4.
All right. Okay. Now, Dolly says, good morning. Selamat hari in advance. Can I get to know regarding stones, if we get, how to be cured? What is kidney stones? Any comment on this?
You have to drink plenty of fluids. I think that's the best remedy. And of course, when you're fasting, if you have prolonged period of fasting, you're taking in less fluids. So obviously there's a greater risk of sediments and not be able to pass out, and a gradual build-up of stones. But I think the best remedy would be to drink plenty of water to avoid getting stones in the first place. Once you have stones in your kidney, then you'd have to. It's a surgical field where you can either remove it through surgery or ultrasound, or various techniques that they have to get rid of the kidney, and by ultrasound or some medications that can help dissolve the stones that help you excrete.
Thanks for that additional comment. Right now, let's get back to the generalities of advice for those who are fasting. Right, as a wrap up for today's segment. Right, what is your overall advice?
Right.
Yes.
So for those who are fasting, those who are with renal failure who intend to fast, get advice on your current status of your kidney function. And also look out for alarming symptoms, dehydration, extreme loss of weight, feeling faint, shortness of breath, tiredness that develops suddenly, or even chest pain, that points to either fluid or electrolyte imbalance. And then also if you have other diseases, like you said, if they're comorbid with cardiovascular disease, with hypertension, with diabetes, make sure that those illnesses are well controlled and you take your medication. So basically you need frequent checks. You know when to stop when your creatinine levels are high. Do not overload when you break fast. Be careful when you break fast.
That's very important.
And also when you break fast, choose foods which are less in potassium, because potassium tends to disrupt your body's electrolyte balance. So basically take little amounts of fluids over the night when you're rehydrating and replenishing food and drink. Don't binge at 7 o'clock or 7:30 and then not eat again until the next morning at 5 o'clock. So spread out the meals. Avoid sweet things and fatty foods.
Right.
So mainly and get as much rest. So the main key would be to do regular monitoring, get as much rest, and monitor your blood parameters if you do want to fast.
That's right. And overall, as well, it's a good opportunity to reset the body and to also inculcate healthier habits.
Correct. Yes.
Right, which we should all do more of, like, for example, spreading out our calories across the day as opposed to just concentrating on a couple of main meals. Right, and also other methods.
Just as an added piece of information, when you fast, actually, there are various neurotrophic factors that are excreted in the brain, and they, in fact, help to create an environment of alertness in the brain and help to regenerate neurons. So in fact, fasting actually allows your brain to also you have a healthier mind, and that helps to keep you more alert. As opposed to just after eating, you feel really sleepy.
That's right.
Fasting keeps your mind quite alert and active.
Yeah, benefits are all there. So particular opportunity, of course, of the holy month of Ramadan to complete one's fast, for non-Muslims as well as an opportunity as well to inculcate similar practices, whether it's with the actual break and the iftar and so on, or with their own intermittent fasting program, because there are definitely many health benefits to fasting, and also to resets, right, the body systems and so on, right, and also brings benefits to the mind and thinking and alertness and so on as well.
On the issue of resetting, actually, in fact, when you fast, the stomach shrinks. So your stomach, you reset the trigger that makes you hungry. So you get full on a smaller stomach. So after a period of fasting of about a month, sometimes you eat less because you get full faster because your stomach is shrunk.
Right.
As opposed to you've been eating the whole year non-stop, and you need more food in your stomach to stop feeling hungry. So it has to reset. It resets the stomach as well.
Right. Great advice there. Thank you so much, Doctor, for the details. Also for sharing some of the associated information, when it comes to fasting, not just for those who have renal disease, but also overall for those who observe the fast as well. So thank you so much. I have a related question here that is related to the foundation per se, by one of our listeners here. Let me just scroll to that question. Okay. Shawal Dua says, what are the conditions for a patient to get sponsorship from you guys, or assistance rather?
All right. As you know, we at MAA Charitable Foundation, we provide subsidized dialysis. So patients can come and approach us, and then we will make an assessment. We will either subsidize with our own grants, or redirect them to various charitable organizations that are able to for them to get subsidized dialysis place. So certainly there's an opportunity for dialysis, and our main aim is in fact to provide, which is why we were established, to provide dialysis, charitable dialysis at a subsidized cost.
Okay, right. And how best to get in touch with somebody from your side?
They could get in touch with MAA Medicare Charitable Foundation. We have Dr. Shazli, who is in charge of our dialysis program, and you can get in touch with him, and we can look at the processes for getting a subsidized dialysis.
Okay, great. Right. Thank you for the information. I appreciate it. Thank you for taking the time out.
Sure, right.
For being with us today. And if you have been joining us live on Facebook, thanks for your attention there as well. In the meantime, that's a wrap for today's
My pleasure.
Momentum.
Thank you very much.
Right. So, Hari Raya Aidilfitri in advance to you.
Thank you. Right. And all the best to everyone. Stay safe. Thank you very much.
Okay, thank you very much to my guests today, Dr. Haji Azriman Rosman, who is the CEO of the MAA Medicare Charitable Foundation, with us right here on a special feature on What Matters. Thank you so much for listening in on air or joining us on Facebook Live. We appreciate it. And as always, if you could share the feed when we're done and when it's posted on timeline, that would be awesome as well, for the benefit and also information and awareness of other people. That's a wrap to What Matters today. I'll be back for music and more still headed your way all the way till 2 p.m. right here on Traxx Momentum, so stay tuned.